I'm Ann, and this is Teal. Teal has had Lyme disease for about 5.5 years. She was infected, we know for sure, with 14 at least ticks the first year at camp in Missouri, and had weird symptoms that year. We couldn't place what was going on. And I sent her back to the same camp where she got another 13 the next year. We're lucky in that we do know if she had actual Lyme or tick bites, but it became very, very severe, and finally after a year and 3 months after the first infection, we figured it out and sent her to a doctor to get her properly tested. She came back very CDC positive, which is highly hard. It's very hard to get, unusual to get such a positive. A few months later, Bartonella showed up. A few months after that, the Babesia showed up. We've been through years of antibiotic therapy, ups and downs and ups and downs. We've tried many, many other modalities and IVs, and just by chance finally happened upon Doctor Sponaugle's clinic, Florida Detox. We've only been here 4 weeks, and when I brought her here, she hadn't been able to get out of the house for 5 or 6 months. She was bedridden. She was almost catatonic. She couldn't even take care of herself. She was in a wheelchair to take her anywhere. She could barely even stay awake the first day we were here. And over the few weeks, all of a sudden, with all the IVs, within a few days, this is now my daughter. She still has a little ways to go because we still need to do more, but she's talking, she's walking. She went to the mall. You know, she's back, and I can't tell you enough how this has turned her life around and mine. It's been hell. Excuse me.
That's fine.
But what I've gone through financially and physically, caring for her, it's been really, really hard. And now I finally can say she's on the road to recovery now.
When I first met you, you couldn't sit up in the chair, and you were sleeping pretty much the entire time.
I woke up to hear a few words and I just passed back out.
And we'll probably, if you don't mind, let them see what your picture compared to now, comparing the two, because it looks like two entirely different people.
Oh, no.
But I'd like to go back, if you don't mind, for a few minutes and ask you, really by age 12, you had ascertained that you had Lyme disease, and you were fatigued, depressed, anxious, all the above, total body pain.
Yeah, there was over 100 symptoms, just little to big, you know, just all over the place, and it was just so horrible that I was out of school, I was bedridden, I was so sick that it was just, I barely made it out at all for a very long time. And even on my better days, it just wasn't past this wall that I just, you know, I kept hitting up against, and it was like right past the wall was getting better, but I couldn't get past it. And coming here, I've been able to get over that, and it's like I don't have, you know, 50 severe symptoms. I only have a few now, and it's nice because the really, really severe things have gone away. And it was that wall that we just kept trying to get past, and we, you know, went to all these different treatments. And
how many treatments? How many different physicians have you seen over the last 7 years? Oh, excuse me, you're 17, so 5 years. You live in Denver.
Yeah.
You went to San Francisco to a physician.
Yeah. Let's see. I saw 2 in Seattle. That's where we first found out I was sick. Then. My doctor there told us that I was too sick to continue regular oral antibiotics, and I needed IVs, and she couldn't do that for me, but a really good doctor in San Francisco could. So we saw him for a while, and we moved to Colorado, and that's when we tried seeing 2 other doctors in Colorado for Lyme disease alone. And actually my mom called an infectious disease doctor just to see what they would say. And they, my mom said she has chronic Lyme disease, and what could you do for her? And they're like, well, we would have to see if she's
We'd have to see her blood work to see if she's worth treating.
worth treating. So it was just.
Did you send the blood work, or you were just turned
No.
off and said forget it?
Yeah. So.
Well, one of the things that you were alluding to is the CDC criteria, the Center for Disease Control in America. They are so antiquated. You have to be practically dead as you were, 1 foot in the grave, before you qualify for CDC criteria. And yet, the best test we had up till approximately a year ago, the antibody test, even from IGeneX and these other companies, it misses the Lyme disease 58% of the time.
Yep.
Because when you're toxic from other toxins, as we proved you were here, the other fatty toxins that you intake through food, indoor mold toxins, benzene, industrial toxins, they shut down the immune system, they shut down the antibody levels. So every Lyme patient I've treated had severe suppression of their immune system, not just from the Lyme toxin, but from other toxins, and they typically don't test positive. So if you tested positive, and in a big way, on the antibody test, then you had severe Lyme disease. I don't know if that's what they were looking for. They want to know if you're worth treating, or were they suggesting if you're too far going, because a lot of the top Lyme doctors in America, there's like 10 or 12, 15 that are like the premier doctors. The problem is they all still use antibiotics. And the majority of the Lyme patients that I treat, like you, have been on antibiotics for 3, 4, or 5 years and don't get better. We've not found antibiotics were sufficient to kill Lyme in our patients or in my daughter, which has a case somewhat similar to yours. But you've been to at least 6 or 8 physicians?
Yeah.
In different parts of the country?
There were some other naturopath in Nevada that we tried. Somebody down in Boulder. So yes, we've seen.
So you live in Denver, but essentially, Littleton, but you've been to San Francisco, you've been to Seattle, you've been to Nevada, New Mexico, or not yet?
Not yet to New Mexico.
Okay, but you've been in at least probably, and I suppose between naturopathic physicians and Western medicine MDs, at least 10 different physicians?
The Western medicine docs refuse to even acknowledge that there is any such thing as chronic Lyme.
Yeah.
And she's been kicked out of offices. She's been told she has a psychiatric mood disorder, that she needs to be inpatient for 30 days. It's been, and we're not alone in that. A lot of...
No, I understand that. I think that's why it's important, and I'm so proud of you folks for doing the video. We had another lady, Meg, who spent 20-some years with Harvard doctors trying to find out why she couldn't get out of bed, and she did do a video. It's on our Lyme page, but we definitely need more. I think for the folks to even understand the difference in you, she looks so bright and happy. Can we get her picture? Do you mind would you mind holding up your picture of when you first came as compared to today?
We can put it in.
And, okay, fine.
We don't have to.
Because I think it would be important, but I'd like for her to actually talk. So if you just get her chart, and we'll talk about some other things. It's so important because all these Lyme patients are feeling hopeless.
Yeah.
And
I know the feeling.
my clinic is full of these folks. I always get them after they've been, we diagnose Lyme in over 60% of our addicted patients and or our, quote, wellness patients, which they come here being not well. A lot of middle-aged women, and younger folks too, but middle-aged women and men who are taken down from Lyme. They never have just Lyme. And I think that's the piece that Lyme physicians are missing. But in your case, the gynecologist that came here disabled at age 38, April of 2010, that's severe. To go to school to your 30 to be a gynecologist and be disabled by age 38. She was 42 when she came, had 4 years of treatment from the University in Alabama. And the treatment from the antibiotics, I think it's important for folks to know, the antibiotics destroy the intestinal lining.
Yeah, they helped me to a point, but then there was just that point that just wouldn't get past it.
The top Lyme doctors in America will tell you that the antibiotics will make you better for a little while, and you're going to get worse. The reason you get worse is the overgrowth of all the bad intestinal bugs, the candida and the Klebsiella bacteria that overgrow the gut when the antibiotics given by the doctors to kill the Lyme destroy the God's good bacteria, the natural bacteria. And then you get all the toxins from the bad bugs, and they hit the brain, and they'll give you a personality disorder or a psychological disorder.
Yeah.
I just can't imagine a, quote, top Lyme doctor suggesting that your psychological symptoms are not from the Lyme disease, because the Lyme spirochete.
Yeah, it wasn't a top Lyme doctor. It was just a regular.
A regular MD.
Yeah. The Lyme literate doctors do know that what all this does, but it's the regular. Oh heck! When she went into the hospital prior to coming here.
You're just crazy.
Yeah, a pain management doctor actually told her that you're a psychiatric case. You just need to, and she wasn't having any psychiatric issues. He just didn't believe in chronic Lyme disease.
Sure.
She's basically been frozen out of regular doctoring where we come from.
Well, the infectious disease doctors in this town are the same way. They think that 1% of the population has Lyme disease, and it's very sad. It is. But at any rate, you've done terrific. I'm going to let you show them your picture from the first day you arrived, November 7th. Today's what, December 1st or 2nd, I think. And if you don't mind, show them your picture. Can you zero in on that? Compared to how gorgeous she looks today. She has a lot of color, and the eyes are the telltale. You look in the eyes, and people are either dead or alive. And if you look at your eyes, when you came here, there's no life in your soul.
Yeah, you can definitely tell. I was I was awake for this picture, barely.
I think we had to wake her up for it.
Yes, we did.
Yeah.
And I wasn't the least bit offended. I know I can get pretty boring with the science sometimes, but I knew you were hurting. And we've had a lot of these other patients that come in wheelchairs. I think it's a pretty cool thing that you came with a wheelchair, and you said you want to donate the wheelchair as a symbolic donation. So
it's here for anybody that might need it until they don't need it here.
It's a very cool thing to go someplace with a wheelchair and leave because you don't need it. And I'm excited, so excited for you.
Me too. It's nice to actually be a teenager again.
You deserve to be a teenager again. You've lost 5 years, but you can always get that time. It can be redeemed.
Yeah.
I think with your intelligent brain, because once we woke you up and when you got the brain working again, you're obviously very intelligent, and I hope you become a physician. You should think about going to school and come back and work with us, because I'm getting tired. I need young, bright kids like you to come through school.
Then you can support your mother in the way she would love to become used to.
That's right. And if we have to, we'll move to Denver. Well, anyway, thank you for just telling the folks your story, because we've treated so many Lyme patients, and we probably haven't been proactive enough in asking them to do videos. And if people don't see the videos, they just can't assume that someone in private practice can do what Harvard or some university can't.
It's actually, we found that, big, places like that are less likely to help you than somebody who, like you, has done, his own research and of ways to really make it work. And, you don't really find a lot of people who have the right treatments for you. Everybody's different, but coming here, it was like, I'd been through so many different treatments that it felt hopeless. But, once you finally started on the treatments, you still had that little bit of hope that you wanted to get better. And it was nice to, actually get better for once.
Oh, it's just great. Well, you certainly have made our day, and thank you.
You made our day.
Well, thank you. All right.